Rabies vaccine. What's rabies vaccine? Rabies vaccine is a vaccine used to prevent rabies. Now what's rabies? Rabies is a viral disease that causes inflammation of the brain in humans and other mammals. Early symptoms can include fever and tingling at the site of exposure. These symptoms are followed by one or more of the following symptoms: violent movements, uncontrolled excitement, fear of water, an inability to move parts of the body, confusion, and loss of consciousness. Once symptoms appear, the result is nearly always death. The time period between contracting the disease and the start of symptoms is usually 1 to 3 months, but can vary from less than 1 week to more than 1 year. The time depends on the distance the virus must travel along peripheral nerves to reach the central nervous system. It is recommended for people at high risk of coming into contact with rabies, when it is given as a course of 2 or 3 doses at 0, 7, and 21 or 28 days. A blood test every 6 to 24 months can check immunity. After exposure to the virus such as from a dog or bat bite, the vaccine is given as a course of 4 doses at 0, 3, 7 and 14 days, along with rabies immunoglobulin. People with a weakened immune system may require an additional dose at 28 days. The first rabies vaccine was introduced in 1885, and was followed by an improved version in 1908. Millions of people globally have been vaccinated, and it is estimated that this saves more than 250,000 people a year. The Human Diploid Cell Rabies Vaccine (HDCV) was started in 1967. Human diploid cell rabies vaccines are inactivated vaccines made using the attenuated Pittman-Moore L503 strain of the virus. In addition to these developments, newer and less expensive purified chicken embryo cell vaccines (CCEV) and purified varicocell rabies vaccines are now available and are recommended for use by the WHO. Oral rabies vaccine. There is an oral vaccination in pellet form which can be left out for wild animals to produce a herd immunity effect. Oral rabies vaccination (ORV) programs have been used in many countries in an effort to control the spread of rabies and limit the risk of human contact with the rabies virus.